Just a few years ago, it was hard to get treatment for all the people infected by the virus that can cause AIDS and other ailments. But now health officials hope to eradicate the deadly virus by 2030.
In 2001, in South Africa, we had only 90 people on treatment on public services. Today, we are talking about 4.3 million people on treatment.
Michel Sidibe is a United Nations official in charge of a global effort to combat HIV. He says progress has been achieved through solidarity between nations and cooperation between the private and public sectors. With more effective medication and availability of treatment, most African countries are on track to control the disease, but not all.
West Africa, Central Africa, completely left behind. When we have 61% of the people on treatment globally, in this region we have only 35% of people on treatment.
Efforts have to be accelerated in the countries that lag behind.
We still have a low coverage in terms of treatment for children, and we need to really accelerate our action on that front.
Cultural taboos are another hurdle in fighting the disease. Sidibe says most African men aged 25 to 39 avoid testing for HIV because of the stigma attached to it, and they continue to spread the virus unknowingly. He says in such societies the effort must be to make self-testing widely available.
The family-centered approach and also community-based approach will become central to what we will do in the future if we want to really reach those millions of people who don't know their status and still continuing to infect other people.
An upcoming UNAIDS conference will focus on improving prevention programs, especially for the most vulnerable groups such as drug addicts, sex workers and homosexuals. Sidibe says it is important to understand that HIV is not an isolated disease, but is linked to cervical cancer, tuberculosis, maternal health and other issues. Since the first cases of HIV were reported more than 35 years ago, 78 million people have become infected with HIV, and 35 million have died from AIDS-related illnesses. UNAIDS started its operations in 1996 to spur local efforts and innovation that would ultimately consign HIV to history. Zlatica, Hoke, VOA News, Washington.